recognize Dr. Joyce for his 5 minutes of questioning.
Thank you, Mr. Chairman, for holding this important hearing, and to our panel for being here today. The United States leads the world in medical innovation. It is critical that the FDA is operating efficiently to ensure that patients in the U.S. have access to the best and, again, the most innovative treatments that are available. There is now more momentum than ever to innovate in the chronic disease space. Ongoing research has found better ways to screen for, diagnose, and delay the onset of symptoms in diseases like type 1 diabetes. A delayed diagnosis of T1D drastically increases medical, financial, and emotional burdens. Frequently, patients go undiagnosed until they land in the emergency room with the diagnosis of diabetic ketoacidosis, a life-threatening complication of disease that can lead to lengthy ICU stays and significant long-term health consequences. The status quo is bad for patient outcomes, and it puts unnecessary burdens and costs on the patient and on our healthcare system. Recently, Adam Schefter visited Washington, D.C., and discussed how his wife's late diagnosis of T1D influenced him to come to Washington to advocate for earlier diagnoses. He shared with us how, despite an adult diagnosis and early challenges adapting to the disease, his wife was now able to successfully manage the disease for over 20 years with the help of an insulin pump and with the help of continuous glucose monitoring systems. To address these issues and to help people more readily identify and manage the disease before it becomes life-threatening, I am proud to partner with my colleague and my friend, Dr. Kim Schreier, on the Screen for Type 1 Diabetes Act. This bill would direct CDC to develop a national education campaign and provide evidence-based screening resources to schools, to pediatric practitioners, and to community health centers. Dr. Kowalski, what is needed to prevent patients from reaching deadly symptoms prior to ever being diagnosed with type 1 diabetes?
Thank you for that amazing question, Representative Joyce. This is such an incredible priority for us at Breakthrough T1D, and thank you for your leadership. I just came from a meeting in Colorado where data was presented that people who aren't screened for risk, who don't know they're at risk for type 1 diabetes, have a approximately 50% chance of being admitted in DKA upon diagnosis, which is diabetic ketoacidosis. This is a very dangerous and potentially deadly complication of high blood sugar and lack of insulin. And in fact, in my home state of New Jersey, we lost a young girl a couple years ago who was misdiagnosed as having the flu and died because she had DKA. This is preventable. When screened, that risk goes from about 50% to less than 4%, saving significant money, potential lives, and we can screen. So we are doing significant work to make sure that screening happens, that people are aware, and ideally that every American is screened for risk.
Dr. Kowalski, earlier in your testimony, you said that we in the United States have the opportunity to become the first country to approve and manufacture a scalable curative therapy for T1D. What would it take from the federal government to increase screening infrastructure and ensure that right now that we seize on that opportunity?
I think this is another example. We keep hearing about the investment in China. We need to maintain our investment here in the United States. Continue to invest in screening, continue to invest in NIH, continue to support a fully functional and robust FDA. These therapies are not a matter of if, they're a matter of when. And we want them to be when soonest here in the United States.
In your opinion, the legislation that I'm working with Dr. Kim Schreier, the Screen for Type 1 Diabetes Act, would that help advance screening practices and promote the early diagnosis of all the goals that we have discussed here this morning?
100%. Thank you.
Mr. Chairman, the Screen for Type 1 Diabetes is a strong piece of bipartisan legislation that will have impact on American lives, which will allow for the early diagnosis and the successful treatment of individuals with type 1 diabetes. I thank you all for being here today. Mr. Chairman, I yield the remainder of my time.